Okay, so I'm talking about never events. And again, they're medical procedures gone wrong. Um, the term never event, which I had never heard of, was first introduced by a doctor named Ken Kaiser in 2013. And he invented the term to refer to shocking medical errors that should never, ever happen. And you can imagine, if you think about it long enough, these are things like wrong site surgeries, where the surgery was supposed to say remove an organ like a left kidney, but instead they removed the right one. So these are clearly preventable, supposedly super obvious surgeries that are clearly identifiable and serious if they go wrong.
Yeah, I can imagine.
Um,
Even less than removing the wrong organ. There's a lot. Like I said, I mean, we've all probably seen those documentaries or shows on TV where it's like an X-ray of clamps and scissors and things that they get left in.
yeah, have you ever had surgery?
No,
Yeah.
I've been very fortunate. I've never even broken a bone. So
Yeah. Well, that's good. There is this. Have you ever been put under? Let me say that.
no,
Really,
no.
it's a really strange sensation. Yeah, I've had my wisdom teeth done. I've had a couple other procedures, not out for like major surgery or anything like that. But there's
Yeah,
this moment as they're giving you the drug, as you're a little happy, and you're wondering, am I going to come out okay on the other side?
sure.
Right? I don't like. What are they doing?
Yeah,
What are they doing when I'm out?
yeah. You
There's a
put
lot
a
of trust there.
Yeah, 100%. We've talked about that before with things like, how much and how many times even on a daily basis you put your life and safety and health in someone else's hands, getting into an Uber, getting on an airplane,
Yeah.
whatever it is, surgery, certainly. And you just have to trust that, that person that spent 10 years or whatever going to school, to medical school knows what they're doing, and that you can trust them.
But
Doesn't always work out that way.
I mean, thank goodness we are living in modern times, though. Can you imagine being operated on, let's even 100 years ago, how crazy that would have been, or let's just say 200 years ago, how just nasty, unsafe, unknown. I mean, we are so fortunate.
Yeah, yeah. Well, 100 years ago, there was a lot of something wrong with your leg. They just lop it off.
Just slap it off.
And
Yeah.
I don't think he's going to make it.
Yeah, there was no never events because they just took care of it, right?
Yeah, pretty much.
So these never events it was a really good idea to identify them, and not surprisingly, the list of never events has grown to include 29 serious reporting events that are now posted on the Department of Human Health and Human Services website. And here are a few I found fascinating, but they're pretty obvious. So things like surgery or other invasive procedure performed on the wrong body part, which I talked about earlier, like got the wrong kidney. Same, but on the wrong patient, which that seems tough, right? You better be looking at your labels, your little wristband before you take the kidney out of the wrong person. And then the unintended retention of a foreign object in a patient after a surgery or other procedure.
I love how proper that sounds, as opposed to left some shit in you.
Can you imagine having to go back into surgery because, I'm sorry, we have a scissors inside you, or a junior mint, like Kramer.
Yeah. Well, yeah, I think the only good thing about that is knowing your net worth would go up a little bit when you came out of the second one.
Yeah, right, exactly. And so, do you find out immediately? Do they acknowledge it? We can't find a pair of scissors, or do you find out 2 weeks, 3 weeks, 2 months later that I got this stabbing pain? It cuts me, but I don't know why. And it's
Yeah.
can you imagine?
That's what I've always heard about is, because anything foreign, I mean, it doesn't have to be something sharp like scissors. It could be, like those little things they take they check your tonsils or whatever, the little wood board. I forget what that's called.
Yeah.
Looks like an emery board or something. But I mean, something like that in your body as you move and just as your body starts to heal is going to cause probably an incredible amount of pain.
And think about the little objects. So we're working now on a micro scale when they're operating, right? You've got ways that they can so-called do surgery without cutting you open, and scopes and stents and all these little objects that if you mess up, you move your arm a little bit one way or another, your fingers, sometimes they're using the little microscopic, it looks like you're looking through a microscope as you're operating. Can you imagine, like, it's like losing a bolt on your garage floor, but smaller?
Yeah. You're making me a lot happier that I've never had surgery, and really hoping my health holds out.
So those are some of the major ones, but then there are a few others that were worth thinking about or discussing that I hadn't really kind of considered in this category of a never event, but they make sense. So a patient death or serious injury when a patient goes missing. So this would be when a patient's at the hospital and they may be in a altered state, if you will. They get up out of the bed. Maybe they say, I don't want to have anything to do with this surgery. I'm gone. And somehow they hurt themselves, and it could be, completely preventable. So that's one. Yeah.
Shoot out the window.
Right.
Yeah.
Yeah. Handcuffed to the bed as a criminal kind of a thing,
You can imagine you're gonna give someone a kidney or something, and at the last minute you're like, nah,
pull the IVs out of the arm.
Yeah, you just running through the parking lot in a gown.
Yeah.
I'm sure it's happened.
Yeah. The next one is artificial insemination with wrong donor sperm or wrong egg,
which could get real interesting.
Yeah, that's not like the scissors stuck in you and you pull it out a couple days later. That is lifetime implications for sure. Yeah. And this one I had not thought of, which is patient death or injury due to electric shock during care. And you can imagine the operating room or even the recovery room. There's a lot of electronics. There's a lot of sensitive equipment. There's liquids, right? Your body is a liquid. It's however many percent water, if you will. Just the shock of that. I mean, can you imagine being shocked from an instrument that maybe was charged? I don't know the specifics there, but that sounds nasty.
But you would think that, there's no carpet in an operating room. It's not like you're going to get the static buildup.
It's true.
But you would think that they have, even a computer repair guy has like a process to get the static out,
Got a little ground next to the blood pressure monitor,
Yeah,
I don't know how these things work.
Yeah, I don't either.
It's why these
it was brain surgeon or a podcaster.
Right. We picked the wrong rabbit hole, right?
Yeah.
Wrong career. So this leads me to a number of stories as I went down my own rabbit hole, discovering some of these, as you can imagine, crazy never events. So the first story is of a man who suffered one of the most traumatic of injuries, especially if you are a guy, you know what I mean. Back in 2013, a man named Stephen Haynes complained of a pain he was having in his right testicle. Now, the Washington Post reported that he had scarring and damage from a previous injury, so he needed to have that testicle removed. So not great, right? But it happens. I mean, I remember a kid in my middle school that, he had one testicle, and, we were mean to him and picked on him and all that stuff.
In middle school, I can't imagine even telling anyone that. You know what I mean? Like as mean as kids can be, I would keep that secret locked up tight in middle school.
Yeah, I don't know about you, but middle school was terrible for me. I was the shortest kid in my class. I was skinny as a rail. They called me every shrimp cocktail. It was just miserable time. I don't need any additional layers, right?
Right. Yeah. And you only got one nut.
So kids are cruel, as they say.
Yeah.
So, anyway, that was the plan, right? To alleviate the pain by course of having it removed. Seemed like the right thing. So that's what they did. The testicle was removed during surgery, but it wasn't the right testicle. It was the left one. And the surgeon actually noted this in his post-operative report. So he acknowledged he got the wrong testicle. So Stephen Haynes filed a lawsuit, and a Pennsylvania jury awarded him $870,000, including $250,000 in punitive damages. And the attorney for Haynes said it's still not totally clear how the mistake happened, claiming that essentially the doctor claimed the testicles had switched sides at some point, like it's some sort of game or anything. Is it that difficult to keep track of these things? I guess so. Yeah.
I don't know. I mean, I have heard. I mean, there is a medical condition, and I
Yeah.
don't, where your testicles get twisted, which is supposed to be incredibly painful.
Painful. Yeah.
Yeah. But I don't in a surgery situation. I don't know how that would happen. It's weird.
Yeah, he claimed that they had removed the testicle on the right side and that it had a spermatic cord that led to the left side of the body. So I could maybe see some of the confusion there and the whole anatomy. So
Measure twice, cut once.
oh,
It's just
cut never. How's that? So wrong site surgery is rare. It happens 1 in every 112,994 cases, according to a public study by the Agency for Healthcare Research and Quality. So about 1 in 100,000. That's not, I don't know, that's not terrible considering the complexity of a lot of these surgeries. But, they don't want it to be any.
Well, yeah, and you have to imagine that number would likely, I think, go up as time goes on.
Yeah.
Just because of the fact that more people have access to surgeries like this and preventive care and all that. I think if you were in the 70s, there wouldn't have been as many surgeries. Not just because of lesser population, but I mean even a percentage of surgery, if that makes sense.
Yeah, and there's also a lot of outpatient surgeries that happen today that maybe would have been a little bit more intensive, and some of them are cosmetic, and some of our, there's a lot more of these things happening, what we do to our bodies, from, putting a band around our stomach to, trying to get an eye job or whatever it is. Yeah. So the Washington Post, as they were reporting on this, wrong testicle being removed in surgery, had a roundup of some other never event wrong site surgeries, and here are a few. So doctors removed a healthy kidney from a man with kidney cancer, which is not great. So you kind of don't have any kidneys. Kidneys are incredibly complex organs in our body. A surgeon operated on the wrong part of a child's tongue. Not good for a kid.
Well, not good for anybody.
Anyone. And an ophthalmologist operated on the wrong eye of a 4-year-old.
That's rough on a lot of levels.
So I went deeper. Yep.
Yeah.
I went deeper and I found more. So this one I had never thought of. There are a few cases of Hispanic families consenting to circumcisions in their newborns, and not understanding what the term means. So they're yes, okay, I'm with a doctor, I trust you. Yes, okay, yes, let's do that too. When you're going through a birth, it is a lot, it's already a lot to think about. You cannot prepare yourself. And when you're being asked a million questions of this, that, and the other, and you have a language barrier, I can see how that would be confusing.
Yeah. I'm going to go with you on that one. I was going to say, yeah, but if you're going to go in, you should have someone there that before you agree to anything that speaks whatever language it is, in this case, English. But I mean, at the same time, being there in the moment, like I was so like, okay, show me what to do.
You want to cut the umbilical cord?
I did, and I'll never forget the nurse handed me the scissors and they had blood on them. You know what I mean? Because she was doing something and she got it ready. And there's somebody's filming this. I actually have video of this, but I was like, just like completely unaware that I did it. But I just was so, so I can imagine in that situation, you're just kind of like, okay, you've done this 1,000 times, 1,000,000 times, whatever. Okay.
It comes at you in slow motion too. My second born came out with the cord wrapped around his head. It's like, oh, that explains what the last 30 minutes were all about.
Yeah, right.
And there's this kind of like, what do we do? What's happening? It's slow motion. All of a sudden you're relieved when you hear it cry. And I actually still have the YouTube video of him crying out there. And It's one of the most popular videos I've ever published, if you can believe that or not. 17 years ago.
Wow.
Yeah.
Yeah.
I was ahead of my time.
Yeah. Yeah. I'll say this though, regardless of all, I don't care how many things you hear about medical mishaps and stuff like that. I mean, I still, if I had to go, through some kind of surgery or major surgery, I'd be nervous anyway, even if I
Yeah.
had the best surgeon in the world for that.
Yeah.
But I still would put my trust in this. I mean, it's just,
Modern medicine, right?
Well, yeah, but I mean, even if I was, whatever, if this was this civil war, you know what I mean?
Right.
And I don't know how to do this.
Right.
You do? Take my money, please.
Yeah, let me operate on myself and see what happens. It's not a good. It's like the Saw movies or something.
Yeah.
So, another one. This is sad and kind of unfortunate and gross. So a man went in to have his appendix removed and later complained of terrible pain after the surgery, which was much worse than before because appendix injuries, of course, that can feel awful. You need to rush in and get that done. He had his bowel contents leaking into his abdominal. I can never say this ever. Leaking. We're going to try this slow, right? His abdominal cavity, which caused him to become incredibly sick. He had not had his appendix removed. Instead, a piece of diverticulitis on his lower colon had been removed by the doctor, so he needed another surgery to repair a leaky colon. And that little diverticulitis guy kind of looks like a mini version of the part of your colon, of your appendix. I guess I could see that, but that does not sound fun.
Well, it sounds like that's probably something he would have had to have fixed anyway.
Right.
So at least now he got it done for free.
Yeah.
And the silver lining.
And more. Yeah. The septus of all that stuff is just, that's a hard thing to clean up and make better and toxicity in your body. Anyway, sorry for that. Here are even more. The same Rhode Island hospital performed 3 wrong site brain surgeries in less than 1 year. And here are each of the 3. The first one is a resident who had failed to mark the place to put a drain in a patient's head. The second separate one, same hospital in Rhode Island, a surgeon marked the wrong side of a patient's head for operating to remove a blood clot. It's all brain specific too. And the third one is a neurosurgery resident cut into the patient's scalp on the wrong side. That's just one hospital.
I'm just picturing the doctors are, they're talking and it's like, yeah, we're gonna cut into the left side. Oh, go wait. His left or my left?
Yeah.
Like
it's terrible to say. Shame on you, Sean.
No. I just mean,
I know.
Like, how does that happen? I mean, I get mistakes happen, but Jesus, that is the most important surgery, in my opinion, I guess, that you could do is brain surgery. Because if you mess up, there's that probably the highest, probability of someone dying, right, on the operating table. So that's bizarre to me.
Yeah, it's tough. And here's one that I think is probably the worst. In January 2025, a doctor administered oxygen to a newborn who was having difficulty breathing. 41 minutes later, the mistake was caught. The baby had been breathing in carbon dioxide instead.
How does that happen? I mean, like, even with an oxygen mask, like, why would there be carbon dioxide coming out through the mask?
That's a newborn too. So
that's horrible.
He suffered severe brain damage, and the family was awarded, as they should, $16.5 million in damage. But that child may never live a long life. The extreme damage that was done so early. Like, if that happens early in a child's life, that has huge implications. Can you imagine that, though?
Call anybody breathing carbon dioxide for 40 minutes. I mean, I can imagine, there's probably no way out of that where you're not affected somehow.
Well, and I think,
right,
trying to be a little bit sympathetic here, just think, I know that they have nurses and whole staffs that are helping them. It's a lot to keep track of. My mom was a nurse, and it is
Yeah.
a lot to manage patients and their health and the stress and the trauma that they're going through. I'm not making excuses for any of this, but it is a lot. It's very complicated.
Yeah. Well, especially the more complicated surgeries and the machinery and just the things they
Yeah.
use for surgery. Yeah, but and there are long hours and
Yeah.
how many hours is a person really mentally good for in a situation like that? But
Yeah.
at the same time, that's the job.
Yeah. I
And
mean, my
you
mom,
know,
as a nurse, when we were kids, she worked the late shift. She worked, I think it was 10 p.m. to 6 a.m. We'd be getting up for school and she'd just be coming home. It's a lot. Okay, so how do we prevent these never events? A 19-item checklist was developed by the World Health Organization to help with this. So there are 234 million major surgical procedures happening each year. So you got to be careful. That's a lot to manage. I'm assuming that's around the globe because it's World Health Organization. Think about that:
yeah.
234 million a year of major surgical procedures.
Plus all the ones that are like black market surgeries in Mexico or wherever.
Right.
Seriously,
Yeah. The unreported.
unreported. Yeah.
Yeah. So here are a few of the more interesting items from their checklist. Before anesthesia, has the patient confirmed their identity and is the site marked? Another report actually recommended the doctors putting their initials on the incision site before the operation, which that seems like a good idea, actually.
That's a signature I'm okay having.
Yeah.
An autograph. Yeah.
I mean, when you first hear it, it feels a little bit weird to like have someone writing their initials on your body, and this is where I'm going to cut, and it feels like they're making a little tattoo of you. But actually, the more I think about that, the more I get why they do it. So that's a good one. Another couple things that they should do before the skin incision. All team members should introduce themselves to the patient by name and role. They should confirm the patient's name, procedure, and where the incision will be made. Makes sense, right? You don't want to have the left brain, right brain conversation. And then obviously confirming the sterility of all the instruments. So that is also key.
All things that should be obvious, but clearly not.
Yep. So that's what I got. Never events. Now you know what these are. I know what never events that I'll never have done to my body. Now you know this, and when you have your first surgery, Sean, you will be more freaked out or less freaked out.
I don't know. I'd love to not have surgery. I'm still pulling for that scenario. I just go through life without any kind of major surgery.
Yeah, I hear you.